Come in.
Hi, Mr. Hoffman. How are you?
Doing well, thank you.
My name is Nancy. I'm a nurse from Harper College.
Oh, it's nice to meet you.
Nice to meet you too. I'm here today to do a breast examination, and I'm going to start with 2 questions. Any history of breast cancer? Do you
No.
have breast cancer? Have you ever had breast cancer?
No.
Has anyone in your family had breast cancer?
No.
Okay. You know, breast cancer does occur in men as well as women.
I've heard of that, yes.
Okay, all right. So we're going to proceed with this assessment to demonstrate how we would do a breast assessment on both a male and a female
Okay.
client. So students, to start out with, when doing the breast assessment, a lot of this pieces of the assessment you will simply verbalize. Ladies, you can keep your top on. You'll be wearing your sports bra for this particular assessment. So we're going to start the assessment, but just by doing an inspection. So what you would be inspecting for is shape, size, and symmetry of the breasts. And you can say normally breasts are round and symmetric, and size you can just say an appropriate size. And then can you stand up for a moment? And then we're going to be assessing the breast for any dimpling or retractions during movement, which is an indication of a possible mass underneath that area of skin that pulls in. So we first just look with the arms at the sides, and then can you put your hands up over your head and put your hands on your hips and flex your pectoral muscles. Good. And what I noticed is that the breasts moved symmetrically and there were no retractions and no dimpling. Okay, have a seat. And I looked at the skin and did not see any lesions or anything abnormal. The nipples are symmetrical and I don't see any discharge from the nipples. All right, so at this point I'm going to have you lay back in a position that would be appropriate for palpation of the breast tissue. I lift this side up a little bit. There we go. And we tuck in a small pad here, and the arm is up over the head. And the reason for that is it helps to spread out the breast tissue so that palpation will be easier. Let me put your legs up a little more comfortable. So at this point, you'll use the model. Okay, so if this is his left breast, okay, here's the tail of Spence. It would be right like this. And the reason that's important is because if we find a mass, we need to be able to identify the location of the mass. So with palpation, you use your 3 fingers, the pads of your fingers, not this part of your fingers. Okay, you don't want to be gouging the person with your nails, so you use the pads. Starting with the tail of Spence, you can do the vertical strip pattern. Okay, you can do the concentric circle patterns. They also say you can do the spokes on the wheel pattern, but that does leave some areas that don't get palpated. What's recommended is the vertical strip pattern. So that's what we will be doing and what I will demonstrate. So starting with the tail of Spence, I'm going to palpate light, medium, and deep. Okay, light, medium, and deep. And you see when I palpate deeply, light, medium, deep, I'm really pressing all the way down in there. Okay, light, medium, and deep. Obviously, with a real breast, it would be attached to the body, it wouldn't be moving around as it is on this table. So I'm going to continue that with the vertical strip pattern, light, medium, and deep. Light, medium, and deep. And light, medium, and deep. All of these models do have some lumps in them. So I want you to identify at least one of the lumps. All right, so this model, I'm going to explain this lump that's right here. So I start by the location. So the location is about 2 centimeters from the nipple, and I use the breast like a clock. Okay, this would be 12 o'clock. So it's at about 9 o'clock. The size is about 1/2 centimeter. It is round, it's fixed, meaning it cannot move, and it's hard. All right. And then obviously you'd move on to palpation of the other breast as well. So at this point I'm going to have you sit up, and we are also going to palpate the lymph nodes in the axillary area. And this is part of the assessment for a man or a woman. For the male breast, you can do the palpation of the breast tissue along with doing the palpation of the thorax at the same time because there's not that much breast tissue there. For palpation of the axillary lymph nodes, that's the same for both men and women. All right, so we're going to proceed with palpation of the axillary lymph nodes. Relax your arm. Relax. So the reason you want your client to relax is so that you really can palpate into the axillary area. If the muscles are all tense, it's going to be difficult to palpate. So start with the lateral axillary, which are really not in the axilla at all. They're under the arm. So you're going to use the pads of your fingers and you're going to use that circular motion. And then relax your arm. So you have to reach up all the way into the axilla to get the central axillary. And then you see that tissue right here? You're just on the inside of the tissue pressing here for the pectoral. And then the pectoral do go down, ladies, probably about where the bra goes across. So all the way down here. And then the subscapular, same thing, it's all the way in the axilla, but then pressing towards the back. So all of these are all up in here, all the way up inside. And that concludes our assessment of the breast.